This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Mon Health Talk for July 1st. Thanks for joining us, and we've got guests in the studio today. First of all, I'm Kyle, sitting in for Dave. You'll hear from Dave coming up on Metro News Talk Line a little bit later on this morning. But in the studio with us, we have Luella Gunter, Executive Director of Philanthropy for Mon Health Talk. Thanks for coming in.
Thanks for having us this morning.
You're a veteran of this show.
I've been here once or twice.
You've been here many times. Also, Laura McCall is with us, Senior Director of Philanthropy with the Mon Health Systems. Good morning.
Good morning.
Thanks for coming in.
Thank you for having me.
Let's get a little background on you. This is the first time that you've joined us, right, for Mon Health Talk?
It is. So I started Mon Health in December. And my responsibilities for the foundation, I develop strategy and work on projects and programs that help advance the mission. And I work to match the interests of our donors with the needs of the organization.
Very simple, but effective. Very good. And Luella, talk about what Laura's input has meant to your organization and kind of getting funds.
Yes, Laura's been an asset right out of the box, so to speak. She has over 25 years of fundraising experience, so we have a seasoned veteran in-house. It's not just me any longer. We have a fabulous team. We have others on our team. But really, you know, Laura and I, our main purpose is to raise money to support the mission. And, you know, I think that's important to start off. It's always about the mission, right? And our mission is to support the hospital. And the hospital's mission is enhancing the health of the community that we are in, one patient at a time.
So you support the hospital, and the hospital supports the community.
That's right.
That's how it works.
That's
okay.
Right.
Coming up a little bit later, we'll talk about some big events, including one this month, a big golf tournament coming up, and then the ball of the year. That's always the big one for the year. But first, let's talk about some of your funding priorities and programs that are essential to the hospital, the Angel Fund. Let's start there.
The Angel Fund is a fund that specifically supports our oncology patients. So we have people who are traveling a great distance to come to Mon Health to receive their care. It's expensive. It's hard for a lot of people to afford the fuel in their car, or maybe they're receiving a treatment that requires them to be with us 5 days a week, right? They can't afford a hotel room. So we have a fund, thanks to the generosity of our donors, that allows us to support those patients with those needs so that they can really focus on the process of treatment and healing.
And Laura, I'm sure in your time here, 6 or 7 months, you've met with many of these patients and many of these family members that just need help. They just need that little extra help. How significant is for you what you do to help these people get through these very, very tough times?
Well, sudden or long-term illness can be devastating to a family. Beyond just what's happening with them physically, you have the emotional stress and that financial stress. Some of our patients, obviously, and their family members can't work. So to have a fund to relieve some of that stress, to offset some of the cost, really makes a difference. And we have the ability to make a difference in the lives of our patients.
We've talked about helping patients and their families, and you also have a fund that helps your colleagues, right? At the hospital that work in the Mon Health system?
Absolutely. So back in 2020, when things had hit with COVID, we found out, our CEO, David Goldberg, came to me. He had found out that we had a nutrition services worker who was literally living in his car with his wife and his grandchildren. And David said, we're not going to let that happen. And so that's when the Colleague Support Fund came into existence. And it's a way to help our employees, our staff, when a real crisis hits, right? Like maybe they're behind and they're about to have their utilities shut off, or they have a car repair that's exorbitant and they're not going to be able to get to work to earn a living. We have the ability to help folks with those needs, which is really rewarding.
Yeah, absolutely. Okay, what about students? Helping students, a young person decides that they want to go into the healthcare industry. And again, the Mon Health Foundation is there to help at times.
Right. So each year we offer healthcare career scholarships. Now you have to go into healthcare because we're about supporting that shortage of workers and making sure that our hospitals have the correct staff in place when you need help. So we offer healthcare career scholarships. These go to both non-traditional students and traditional. We have an application process. We usually launch it right after the first of the year so that we can go through the process objectively to award these scholarships and typically award in the spring so that, you know, the students know what their financial package is going to look like. It's expensive.
Very much so. Yeah. And Laura, this is an opportunity to help the next generation along, right? We need people to get into this industry.
Absolutely. And, you know, through the years of the scholarship program since 1991, we've given away over $1 million in scholarship funding for that next generation.
Okay, something new, at least over the past 6 or 8 months or so, the caring cottages. What's that all about? First of all, where'd the idea come from?
Well, I have to give credit where it's due. It really came from our CEO, again, David Goldberg. He's the visionary, right? But you need that. You need a leader with vision that thinks outside of the box and says, look, this is a real need in our community and a real need for our hospital system. So the idea came about, and our wonderful auxiliary, which I know we're going to talk about in a later segment, but they said, look, we want to put our Ball of the Year funds, and this was from last year, towards building caring cottages. So caring cottages starts as a duplex-style home, so you can have families on each side, right? And it is for patient stays, patient-family stays. So just like we were talking about with the Angel Fund, those patients that are coming in traveling a long distance, we now have the ability to house them in a very home-like setting. I mean, there's a washer and dryer. It will be like home away from home to help these families. And we are so excited about it.
All right. So this is an ongoing project, right?
Absolutely.
Okay. So where do we stand? Where are we at in this process?
We are moving dirt.
All right.
Dirt is moving. We are very excited about that. But really what's interesting about this project, the tract of land, and it's on our campus for Mon Health, it would be right off the old Mon General Drive, which is how a lot of people know it. We have the ability to build this first duplex, but we can expand and build more. As we trend out that volume and need, we can go up to 6 different cottages.
So you've got some room there. I mean,
Correct.
that's one of the advantages of your location is there's a little bit, actually there's a lot of room to expand, right?
Exactly. Yeah.
Okay, very good. So the majority of this money, a lot of the money comes from patients who have received excellent care at your facility, and they want to say thank you. Is that a correct statement?
So unlike academic institution or university, we don't have alumni per se. We have our patients, and that's really where our donor base comes within our community. And a lot of our patients want to give back because of the care they received. It could have been life-changing for a lot of them, and it provides an outlet for them to express their thanks. So we're excited about Caring Cottages, our Angel Fund, our Comfort Fund. We have a lot of different opportunities for our patients as well as people in the community. You know, the community hospital is important, and we feel that people should have a choice with their health care.
Yeah, it's vital. Community hospital is vital.
Absolutely.
To the fabric of a community. Okay. Give us a quick anecdotal story if you can, either one of you, or if you each have one. You don't have to name names, but give me a story of a patient who received outstanding care and they've decided to give back?
So I would say that really goes across all of our service lines, right? We have examples from oncology to heart and vascular, and many others. But from our heart and vascular side, I will say that I have been so impressed by the care team and what they do, the amazing work they do. I mean, they're saving lives. A lot of people are saving lives, but we've had patients walk in to say, my life has completely changed. I can walk again. I can breathe again. They have done heart procedures that have totally, the quality of life has changed. And those patients, I've had several just walk in and write a $25,000 check and say, I want to support my care team. It's amazing, the generosity of people. But what I would also say is I have patients who send us gifts, and maybe they're $25, not $25,000. Yeah. Guess what? Those gifts matter. Every gift adds up, and we appreciate the 25 as much as we do the 25,000.
Sure.
And the thing that I've heard since I joined the team is the personal touches of the physicians and the care team. The cardiologist or the oncologist who gives out their personal cell phone number that follows up the day after the surgery, not a nurse, not somebody on the team, but the actual physician, surgeon who did the procedure, that they know that they can reach out, and if they have any questions, they're going to the expert. And I think that makes a difference, that our physicians take the time, it's genuine, and they truly care about the patients. And, it goes back to our mission at Mon Health.
Absolutely. This is Mon Health Talk for this Monday. Thanks for joining us on WAJR. Our guests are in the studio this morning. Luella Gunter, Executive Director of Philanthropy for Mon Health, and Laura McCall, Senior Director of Philanthropy for the organization. We're going to take a quick break. We will continue the conversation. You're listening to Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Talk for this Monday. Thanks for joining us, and thanks to our guests for coming in the studio this morning. Luella Gunter, Executive Director of Philanthropy for Mon Health, and Laura McCall, Senior Director of Philanthropy, who's fairly new. Within the last 6 or 7 months, she's joined the organization. Okay, we've got big events coming up, including one in just a week from now, the golf tournament, the Fundraising golf tournament. West Virginia WVRC Media were involved in that as well. And Luella, just take it from there. How special this event is and how people can get involved.
Well, thank you. We've been doing the golf tournaments now for almost 35 years. And it's a wonderful opportunity to bring everyone together for some fellowship at the golf course. But of course, we are interested in the fact that it's raising money to support the mission of Mon and what we do, the programs that we've been talking about. So July 8th will be our WVRC Media Golf Classic at Pete Dye, which you just mentioned. And then in August, we have the DeLynn Memorial Golf Classic at Pete Dye, August 5th. Jean and Laurie DeLynn were well known in this town for many years, and they were known for their philanthropy, and they supported our hospital system as well. So they have chosen in memory to name the tournament as the DeLynn tournament. So we're happy to continue that tradition.
Okay, so a couple of golf tournaments, July the 8th. That is the WVRC Media Invitational at Pete Dye, and then August 5th, the DeLynn Memorial Golf Classic, also at Pete Dye.
Correct.
Again, if people are interested in getting involved, playing, or being a sponsor,
they need to go to monhealth.com/foundation.
Okay.
All of the information for our tournaments is there, registration, and of course my contact number so that they can personally reach out.
And that is not only the golf tournament, but anybody who's listening and has been helped through the years by Mon Health, they can go there and make a donation.
Absolutely.
Okay.
All of our funds are listed, and anyone can choose what's a personal passion for them that they would like to help with the hospital system.
Also at that site, all the details for the Ball of the Year are there. No?
That's a different site.
Okay. Different site.
That's
okay.
a different site. That site is theballoftheyear.com.
All right.
The word "the" is important. That's going to get you right where you need to be.
Okay, so theballoftheyear.com, all of the details for the Ball of the Year. Laura, how excited are you to be involved in this for the first time?
Well, this year, the Ball of the Year, excuse me, we're celebrating the 60th year.
Mm-hmm.
And so, which is very exciting to have the event for 60 years, but it's also our auxiliary's 80th year. So our auxiliary has been in existence for 80 years now. So it's a pretty big year. The theme is Wild, Wonderful, which we all know, Wild, Wonderful West Virginia, but it's Wild, Wonderful, Whimsical. So if you want to know what the whimsical is, that means you got to come to the Ball of the Year on November 2nd.
Got to go to the website and check it out there, and then you got to show up.
That's right.
To find out all the details. Okay, so the auxiliary has been around for many, many decades. The Ball of the Year, celebrating an anniversary, and Luella, the foundation itself, is coming up on an anniversary.
A big anniversary. Yeah, there's a lot of big milestones this morning that we're discussing. The foundation came into existence at the hospital in 1975. So we're coming up on 50 years next year. So I'm sure we're going to have lots of celebration around that. But it has grown. You know, I had the privilege of starting with Mon Health in 2019. So I've been there 5 years. And I had the privilege of working for a very short time with my predecessor, Mr. Bill Hennessy. Well known. Everyone knew Bill. But he did an amazing job to build the groundwork of the donor base for that hospital and spread the message of what we do. So I walked into a really great opportunity to build upon. And we've grown. We've grown over the last 5 years. And it's really not about me. It's about the staff and the physicians and what they do every day, because that's how we've grown.
Yeah.
That quality of care and the patient base that has grown and grown. And of course, now that we are bringing patients in from farther away. So we're really pleased to see that. We've diversified our funding sources. I mean, that's been a big thing that we've focused on over the last 5 years, because let's face it, I mean, we have a lot of competition in our community for asking for donations. We've got great, worthwhile organizations. I applaud many of them, but we all kind of go to the same people, right? So we needed to diversify funding, grow our annual fund, and really focus in on our messaging and what's important for our patients. What do they care about funding?
Yes, and you mentioned Bill. Bill, a great friend of the radio station through all these years, and we're privileged that you have kept up your relationship with our company, and it's a mutually beneficial relationship, and we really appreciate that.
We appreciate it.
Laura, again, you're fairly new to this system, but you have vast experience in fundraising. What makes the Mon Health system, what makes this hospital and this hospital community special? What makes it stand out in your mind?
So healthcare fundraising enables growth, and it allows institutions, our organization, to expand access and to secure life-saving equipment. We want to make sure that our patients have a choice, that if the only way we're going to be able to really grow is through private support. Your patient payments for service makes up a lot of the majority of the revenue, but that's for operating costs and sustainability. We need private support for the growth, and when you look at the build-outs and the expansion of our areas in Vandalia Health, my job coming in as, a seasoned fundraiser, and now there are two of us, Bill did it all himself, that it's really to support and enhance that growth.
Yeah, that's very well said, that the funds are needed to expand and kind of stay on the cutting edge that Mont Health System has always been on.
Absolutely. That's what we need to do. And, you know, we prefer to call it the margin of excellence, right? It's that extra that allows us to pivot and flex and be able to do things and purchase things that are not always included in an operating budget. So oftentimes, you know, the hospital system has come to the foundation and said, we need a very specialized piece of equipment that would allow us to do a specialized procedure. Thankfully, we have an engaged and dedicated board of directors at our foundation who understands those needs. And 9 times out of 10, they're going to say, yes, let's get that and do what the hospital needs for the best quality of care for our patients.
Absolutely. Well, ladies, you've done a remarkable job in keeping this all together. Bill, I'm sure, is very proud.
He is. He calls and tells me that.
That's great. That's very good. We appreciate your time this morning, and best of luck with the upcoming golf tournaments. July 8th, the WVRC Media Invitational Golf Classic at Pete Dye. August 5th, the DeLynn Memorial Golf Classic at Pete Dye. And the Ball of the Year, that site is open, the Ball of the Year.
Correct.
That's the website.
The Ball of the Year.
Go check that out and get signed up. Get your tickets, get in place to go to the Ball of the Year, which is set for November 2nd. Ladies, again, thanks for coming in.
Thank
we
you
appreciate
for
your
having
time.
us.
That is Mon Health Talk for this Monday morning. Thanks for joining us, and we invite you to stay tuned on WAJR for the news, which is coming up next, then Talk of the Town here on WAJR.